Sophia Matovu. Now tonight, like we always tell you, some of the topics that we bring into your living rooms are topics that you have requested. Many people have talked to me and have complained that there is lots of cough and flu. It's like it's an epidemic out all of a sudden, and indeed it is true. But since I'm not the expert to talk about it, I have none other than Dr. Sabrina Chitaka, who is a specialist pediatrician, but also a senior lecturer at Makerere University College of Health Sciences. She took a lot of time to sacrifice and say, let me come in and have this talk and educate the public about it. Good evening, Dr. Sabrina.
Good evening, Sophie. I'm so happy to be here.
Okay, thank you.
Good evening, viewers.
Okay. Now, Dr. Sabrina, let's start with just the simple basics. What is flu? Because there are certain times people struggle with different things and have given it all sorts of names and confuse it with lots of other things. Let's start with just the basic simples. What is flu?
So flu in medical terms is coryza. It's a runny nose, and it is when you have mucus flowing out of your nostrils. That's basically what flu is. It may present with a fever, a headache, joint pains and muscle aches, and that's what flu is. And when there's a flu season, like now, you're going to get lots of people sneezing, with a runny nose, and then that flu can complicate and become a cough or even a pneumonia. And so, yeah.
And then what is a cold? Because I think we seem to confuse them.
So a common cold is, it presents with flu-like symptoms. And a common cold, many times also, the things that cause it are the ones that cause a flu. But when people say flu, it could be a common cold, but some people have allergies and they're constantly having this flu. So flu is maybe picked out of a bug called influenza or para-influenza, but generally speaking, flu is when you have a runny nose. And then a common cold can be caused by viruses mostly, but it can also be caused by bacteria.
Now, as you were explaining, you say this is the season. Are there specific seasons we have in Uganda where you would say, like now, it doesn't surprise you that we have flu?
True. When it's cold and rainy, you anticipate that all the flu bugs are going to be flying around. And people huddle in their rooms in, small spaces, and they can spread the flu from one person to another. It is during this cold and rainy season that we have the monsoon winds blowing from the east, for us, the Indian Ocean. And they will come in with all these rhinoviruses, coronaviruses, and all sorts of viruses. And so people who have allergies especially will be likely to develop flus, but also people at the extremes of ages, little babies, elderly people, they'll all be suffering from the flu. In the temperate countries, the flu season is especially during winter, when it's extremely cold and people's immunity dips a little bit. But for us who have been used to high temperatures of 26, even 32, and I know that in some places in Uganda, the temperatures even went up to 40. And then out of the blue, the rain comes, and the temperatures have dropped now to even close to 15. People cannot tolerate those levels of temperatures. And those who have allergies, those who are immune compromised are going to be getting the flu a lot.
Now, the biggest complaint that some of the people out there in the public are having, the flu is a lot among the school-going children. It's a combination of flu and cough.
Correct. And we know that many schools have crowded classrooms. So I'm not surprised that when babies and children who are at school are in a class and there's one person coughing or has a flu, they are likely to spread it to other people. Because remember, coughs and flus are aerosol spread, but they can also be spread with hands. Like if they don't wash your hands, remember during the coronavirus season, it was wash your hands, cover your nose with a mask, don't touch your eyes, nose, ears. You remember?
Yeah.
It's the same here. So if you have coronaviruses, if you have rhinoviruses floating around, and people who are coughing and have flus are not covering their noses with masks, they're not washing their hands, little babies are sharing lollipops, juice, they're in a crowded space, it's cold and rainy, they're not going outside to play in the sun, obviously they are going to get it spread around. The other thing that we see now is that people who have allergies, especially people with asthma, with allergic rhinitis, with allergic pharyngitis, it's during this cold and rainy season that they get spark coughs of their allergies. And so the coughs and flus are a lot. But there are people also who don't vaccinate their children. And for me, those are the ones I am worried about. On our ward, on the infectious diseases ward at Mulago, we have so far seen 3 children with measles, and this has been confirmed at the UVRI. So it's really measles, it's the mobiliform type. And all the babies who came in with measles, they were not vaccinated. Sadly, one of those children lost a sibling, and the mother is just there, no, I don't vaccinate my children, and too bad we've lost one child because they were not vaccinated. So.
Okay, because now, when these kids spread it and get it a lot, like now around this season among us themselves, they go spread it at home as well.
To the parents.
To the parents and
who
the
may
others.
be stressed out and who may also be having underlying immune suppression. So the people who cough and have flus are all getting sick right now. But let's not forget that COVID-19 has never left. It comes in blips and, you know, it keeps hanging around. It's just one of those viruses that causes a flu, and for some people who have underlying conditions, it may cause other complications. Yeah.
Now, when these little kids come from school with their flu, how should they be handled? How should they be managed?
Good question. And I've heard that parents would like to manage, you know, have home remedies, which are amazing. The home remedies include giving honey, giving some lemon, and garlic, steaming, but all those are things that are helping the child to boost their immunity. If the fever comes with this flu, don't do home remedies. You may give paracetamol, yes, but if a child starts getting complications, like is breathing very fast, is starting to get a headache, gets a convulsion, do not wait at home giving home remedies. Please take that child to the hospital so that they can be treated correctly. Because sometimes it may start with a viral infection, but then it becomes complicated and gets a bacterial infection. The infection can spread into the bloodstream and go to the brain, or get into the lungs, or even get into the intestines.
Because now, at least for them, you'll find that they recover and they heal a lot faster. Has that got to do with them having a stronger immunity vis-a-vis the adults?
Well, I think for many adults, the worst disease they can ever get is a flu. I think I'm one of those people who don't want to get influenza because it makes you feel really terrible, like headache, the runny nose, you're uncomfortable. I think it's like malaria. It's like you don't want to get malaria, you don't want to get influenza, and it can be terrible. So I think whereas we think, yeah, children get better quickly, it depends on the infection. Some infections also really treat children badly. And we know that all over the world, nearly 300 million children suffer from pneumonia and even upper respiratory tract infections. And over 300,000 children die on a yearly basis because of upper respiratory tract infections and pneumonia. If you don't address the problem quickly, if you don't treat the underlying problems or the complications, children die. They will require more oxygen. They will require to be hospitalized, and then they'll be losing school time. The parents will be losing work time, and it's all a big complicated problem.
Why does the flu keep reoccurring? You know, there are times you'll think that since you have treated your child and they're back to school,
They get reinfected.
then they get reinfected again. Why do they keep getting reinfected?
They get reinfected because, remember, it's survival for the fittest. Even viruses and bacteria also develop mutations, which are small changes in their genotype, so that they can survive. So the flu bug that could come this March will go and change, and it won't be the exact same one that will probably come in June. So for some people, they'll keep getting that infection and getting the infection. And remember, in Uganda, we do not really vaccinate against flu.
Yeah, true.
We don't. In other countries, the flu vaccine is a mandatory vaccine, but here we are not yet there. But we are getting better by giving more and more vaccines, because, for instance, instead of the 6 vaccines that we used to give, now we are at about 12 vaccines, and many of those vaccines are preventing kids from getting coughs, especially, and pneumonias. Like, for example, the whooping cough vaccine, the pneumococcal vaccine, all those are really useful vaccines that we used to see children suffering a lot from pneumonia and meningitis and all those things. But now they are being vaccinated and they are prevented. We mentioned measles, and then even polio. Polio can give you a flu as well, much as it will start with a diarrheal disease, and some children can become lame. But as we vaccinate more and more and more, and you have what we call herd immunity, you're going to get less and less people getting that disease. It's like if you have a herd of cows, and then you vaccinate at least 80% of them, then the vaccinated ones will be protecting the others. But if the unvaccinated population becomes bigger, that means you're putting the total population at risk.
At risk, yeah, true. Then tell us about the cough, because that one is also
Again, cough. And there are some people who say, oh my God, my baby has coughed for 5 months. I had a call from a dad last night, and he said, I don't know what to do. My baby is 5 months but has been coughing since the child was born.
That is not
That's
nice.
a lot. I mean, coughing is a reflex action, yes, but children who cough and cough all the time, we need to investigate them, because it could be from tuberculosis to asthma to a heart disease, and you're just watching the child having a cough. Coughs should be investigated, especially if they go beyond 2 weeks, because we know that tuberculosis, and I think tomorrow will be the World Tuberculosis Day, TB presents with a cough, it presents with a fever, weight loss. So we need to be aware that a little cough, you know, like a cough which is a slight cough, shouldn't worry people. But a cough which presents with a fever, with difficulty in breathing, that's a serious cough. A cough which has sputum production, the one we call a wet cough. A cough that presents with a whooping sound. A cough that presents with a wheeze or a stridor, like noise when the child is coughing. That should worry the parents. Don't just sit back and, oh, my child is coughing, and the child is coughing 1 day, child is coughing 2 days, a week, a month. No, that's dangerous. Get the child investigated fully so that the correct treatment is given.
So, particularly right now within this season, what type of cough are the children experiencing a lot? And somehow it goes hand in hand with the flu. It's a combination.
Yes. So when the child gets the flu, and the flu is not managed well, you know, like giving multivitamins, ensuring that the flu dries up, giving an antihistamine that is useful, that thing, the bacterial virus that has caused the flu, can then multiply and get into the lungs. And the lung has airways called trachea, bronchi, bronchioles, the alveoli, the entire, I wish I could draw that tree. But once there's swelling of those air spaces, then pus-like material starts to form
In the lungs.
in the lungs, and that is what the person coughs up. Remember, if a person has a pneumonia or a complicated flu, and I'm saying flu in inverted commas, because flu could be anything from a runny nose to even a sore throat to it going downwards. It can become complicated. And if that is not treated, if you see yellow sputum, like you have a wet cough and you're coughing up yellow substances, or you have a wet cough and you're coughing up blood, that should worry people. It could be bacterial, it could be complicated, like you could have pus in your lung. Yeah.
Oh, wow, wow. So why do the two somehow go hand in hand?
They go hand in hand depending on how severe the virus load is. So if it's a big virus load, then it will go down into the lungs.
And will combine and then
And give you that cough.
Then is it true, because I hear that some people who have had a surgery and undergone and had tonsillitis removed are bound to be more affected when they get flu? It is really a nightmare for them, so they say.
Not really. So tonsils are glands which help to fight infection. And for some people, they have recurrent tonsillitis, and the tonsils are just somewhere in your throat, and they could swell, they could become enlarged, they could become complicated, and sometimes they need to be removed. But that doesn't prevent people from getting another flu-like illness, or even getting the structures in the throat infected.
Okay.
Yeah.
Now we have lots of parents, like you said. You talked about the other remedies, but we being the Africans that we are, we normally have our remedies also when it comes to issues of cough.
I've heard
and a lot of those Gabogola.
That one.
There is that one. Then there is, it's called, I think, the bottle brush that is called Mwambala Butonya in Uganda. We use lots of those concoctions on the children. So, and I know that herbal medicine works sometimes to soothe the throat, but it's not an antiviral, it's not an antibacterial agent. And also some people may overdose the kids. For me, that's my biggest fear, that if you've not got it from a real provider, maybe a tincture that has been tested and tried and recommended by the National Drug Authority, you may end up injuring a child's liver. And that can be dangerous. We also know that some people mix tinctures and things, and they add in real formal medicine. And it may be overdosed, and that can be dangerous as well. So getting things like garlic and honey and things that will soothe the child's throat and give them less discomfort is important. But also hydrating that child is just as relevant. Hydrating them with water, with juice, with tea, with milk, with whatever is available to hydrate them is good. Okay. Now, at what stage? You know, also another illness that most parents have, we are very used to, like, you know, how should I say, based on what it is, off-the-counter drugs. If I know that maybe like amoxicillin syrup has been useful to this child at the time when they encountered this, when the child gets the same symptoms again, we'll quickly run to the nearby pharmacy and pick the drug.
So the next big epidemic that we are going to face is called antimicrobial resistance. And it's going to be like a World War III. The more we abuse antibiotics, the more the bacteria and the viruses are also developing their own weaponry. So a time will reach when that child you're giving over-the-counter amoxicillin gets a real bacterial infection, and you cannot treat them with it. We've had to do blood cultures on children who come in with meningitis, which has become a complication of a cough and flu. And now they have meningitis, or they have a bone infection, and then we need to give them a more expensive antibiotic. Like we've moved from the first level, moved from the second level, and now we're on the third level of antibiotics. There are medicines in this country where you spend over 1 million shillings per vial to treat a patient. I don't want to have a ward full of children where I cannot use the basic antibiotics which are going to treat the child, and having to need more expensive antibiotics that will wipe out the entire account of the family. That's unnecessary. So, dear friends, dear parents, let us not become self-taught doctors. Doctors go to school for not only 5 years, but 18 years before they become a commissioned doctor. And some people have turned themselves into Google doctors. For every ailment, they are out and searching on, ChatGPT or Google, and self-prescribing.
Yes, true.
Self-prescription is dangerous, because if I prescribe for your child, you're holding me accountable to that prescription. Should any problem happen, I will be liable.
Yeah, true.
To any problem. But if you're the mom, you've given your child an antibiotic off the counter, who are you going to blame? Not that you should be blaming somebody, but let us be professional and let us respect people's professions for the safety of the children.
Yeah, very true. Then what is the right bit to use? Should they use handkerchiefs when these kids have a runny nose, or would they rather use tissue that they can keep disposing of?
Nice one. I really like that question. I don't know when I last owned a handkerchief. I am a tissue person, because I know that if I probably got an allergy or whatever, I'll be dropping away the tissues. But some people prefer handkerchiefs. If they can have many handkerchiefs, use and keep away, use and keep away. The trouble with people who are handkerchief savvy, they will use the same handkerchief for
the entire
days on end. And that handkerchief will be reinfecting them. But if you have an active flu and a fever, and my goodness, it's better to have a pack of tissues and just keep throwing them away.
Wow, that's a good one. Well, we're talking about cough and flu, and especially in the children who keep reinfecting the parents, or who keep getting reoccurring cough and flu. But at this particular point, let's take a very short break. Then when we do come back, we're still going to expound more on this topic as you requested.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
She is the future of Uganda. And as a policy maker, the policies I enact today will protect her from child marriage and teenage pregnancy. We each have a role to play in empowering our teenage girls to protect them from child marriage and teenage pregnancy. Because when we empower them, we empower our nation. Protect the girl, save the nation.
Take action. Report any case of defilement or child marriage to the police or call Sauti 116.
With God, comfort replaces pain. Peace replaces confusion. Hope replaces sorrow. God loves you and knows you personally. He hears you and speaks to you in your thoughts, in your heart, and through living prophets. Come hear the words God has for you. Watch the General Conference on Sunday, 2nd of April.
Jerry Con! Jerry Con! Hey, Master Blaster! Touch him, man! Bang Jerry Con with muscle! Those ones who say go for you only. Mundava! Best movies I teach you. But I'm going to put them scary because of the camera is very far. Is you serious? It's serious, you. What? Eh? You stay put on it. Add kilometers to your legs and you get your sugar. We buy meat from Umaru and Umaru refuse to give you enough meat. Mama! Show him that they don't joke with you. Umaru, wait.
Okukakalukana okulungi kwetaagako omuntu akuyambako, n'olwekyo tujja kukuteerawo embeera esaanidde osobole okukola ekisinga. Awamu teri kitulema.
TB kills approximately 30 people daily, and 247 Ugandans fall ill of TB disease every day. TB has killed dreams and families. We all deserve a chance in life to hustle, smile. We all deserve a chance to dream and be the best version of ourselves. It is preventable and curable. Know your status. TB testing, treatment, and all TB-related services are free in all government hospitals and accredited private health centers.
Okay, welcome back from that short break. You're still watching You Health Chat, proudly sponsored by National Medical Stores. And of course, with me in studio is Dr. Sabrina Chitaka. She's the specialist in this area when it comes especially to young children. Now, Dr. Sabrina, we're still talking about our cough and flu. Now, this we use during COVID, but I believe is also one of the treatments, should I say, that is used quite a lot. I've seen parents give their little ones, there's that vitamin C that they suck when they have flu. How effective is it?
So when a person gets a cough and flu, they get injury to their mucous membranes, the thin lining that covers your nostril and goes down to the lungs and the airways. And vitamin C is intended to improve on the immunity.
Okay.
However, I wouldn't recommend to parents to give vitamin C for a year. It should be for that short time when the child has a cough and flu, and then the rest of the vitamin C they can get from natural products. Watermelon, oranges, bananas, that can give you the vitamin C that you need. Because remember, 1 tablet of vitamin C contains 1,000 milligrams of ascorbic acid. It's an acid.
Oh, wow.
And then you're loading this child with acid after acid after acid and throwing them into risk of getting gastric ulceration. So limit and also get a correct prescription. Do not give too much.
Then at what point do the parents, some of them have, will say when the child feels the nose is congested, they'll go to the extent of using the nasal sprays.
The nasal sprays are mostly corticosteroids, and the more you push corticosteroids up the nose, you're giving immunosuppression to this baby. Corticosteroids are prescription medicines. Don't just give them over the counter, because remember, they can be absorbed into the bloodstream and they can cause their own complications. Corticosteroids have been associated with gastric ulcers. Corticosteroids have been associated with shortening of the bones or closing the growth plates. or even giving a condition called Cushingoid syndrome. So, you know, for me, the best advice I would give is that get a correct prescription and do not go over the counter and give a nasal spray, because not every cough and flu is going to be treated with a nasal spray. And besides, you may be giving this steroid, which may be valuable in other conditions, like if a child has allergic rhinitis, allergic pharyngitis, that will help. But if they have an underlying bacterial infection, then you're giving the bacteria a good medium of waking up and growing and dancing around and giving you serious complications and disease. So let's go slow on those nasal sprays unless they are prescribed by a qualified doctor or a pediatrician. Do not just use them.
Now, when the child is haggling, at what stage should the parent bring the child to the hospital? Given that at times, I might say, day one, they'll go through it, day two. At what stage do you recommend them to come to the hospital? Because we don't want to wait for the alarming stage.
Yes, so there are danger signs that you should watch out for. And one of them I said is if the fever is not going down with paracetamol and even tepid sponging and hydrating that child, the fever is just continuing. If the child starts to breathe with excess effort, that's a danger sign. Bring the child to the hospital. If a child has a cough, difficulty in breathing, and has a fever, that means that the child has developed pneumonia. So don't sit at home thinking you're going to give your honey and juice, because pneumonia is a dangerous disease. And before you know it, the child will be requiring excess oxygen. I forgot to bring my pulse oximeter. We could have tested each other and seen what's the oxygen saturation in this child. So when a child develops pneumonia, they have excess effort in breathing. They are using all their muscles of respiration to breathe, to try and suck in more oxygen. And sometimes they even turn blue, something we call cyanosis. So that is a really dangerous sign. If the child becomes drowsy, you're trying to give them something to drink and they are not taking it, that means they are getting fatigued. Or maybe the bacteria or viral infection has now gone into their brain. And that stage is also bad. If a child has a cough and flu and starts to get convulsions or fits, that is really dangerous. It could mean that the child has developed meningoencephalitis or has developed complications from that cough and flu.
Now, there are certain times, because of how people earn, they will prefer to run even sometimes to the nearest clinic in the neighborhood where they can afford to get treatment on credit, and you can always keep going and paying back. Given the symptoms that you have talked about, or the signs to, you know, that raise the alarm bells, where would it be nearest for them to go when the situation is at that level? Because you don't know what to expect.
So, I'd relate this to a car. If you are driving a small car, I won't mention which one, versus if you're driving a large, fancy car and it gets any problem, are you going to take your car to a mechanic on the road who fixes borders, or will you take the car to, you know, the manufacturer's recommended mechanic? And children are precious. If you think that your child is worth, you know, borrowed medicine, their lives are so cheap, then that is the kind of parent that we are thinking you are. And unfortunately, poverty and health-seeking behavior are opposite in relationship. They have an adverse relationship. People who don't have enough means are likely going to be the ones to get care and treatment from the cheapest places. And by the time the child comes to a tertiary institution, it's too late. I hate to say this, but if your child has a pneumonia, you cannot be seen going to buy Bocapso or Webibiri, because that's not going to treat the child. The child is going to require oxygen. The child may require an IV line and being treated with more expensive treatment, and so that we can save the child. So the bare minimum should be a health center, 3. And government facilities are available, and the treatment is intended to be free of charge. People have been derailed by the last 2 years of COVID-19. Indeed, people were frightened and they were afraid of getting into big hospitals, but the COVID-19 virus has sort of reduced. It's still lingering around, but it's not as scary as we had it before.
Yeah, true.
So people, don't be afraid to come to the hospital, because you're going to get the correct diagnosis and treatment. It starts with the correct diagnosis.
And treatment, true.
Correct diagnosis, correct treatment, better survival.
I'm not going to ask you what treatment options should they use, because now we will
They'll be writing
down notes.
Dr.
and
Sabrina said, buy this, buy that, buy this, buy that. But you know, the village health team members have been empowered to even treat an urgent disease. They treat malaria, they treat pneumonia, they have the medicine. So, and they've been trained. And the village health team members or the community health extension workers, they know exactly what to do. Go to a, you know, the drug shops are manned by nurses, qualified nurses, and they know what to do. But for heaven's sake, don't go and start buying the medicine on your own as a parent who is not a medical worker, because you may be treating the wrong thing.
Doctor, you've said that now we have a category of some of them who will even go, because you know, I sometimes feel sorry for some of us, because sometimes some parents have opted to going to the pharmacy as opposed to going to seek the help from the doctor, because we're evading that consultation fee. Yeah, so somebody will go there, since they know that these pharmacists know what medicines to give, tell them what the child is suffering from. The child has cough and flu. Remember, the child hasn't been diagnosed, and based on their expertise and knowledge, they will prescribe what they believe is appropriate.
I don't want to get into that debate, because my pharmacy colleagues are there watching to see what I'll say. But the truth is, if you feel that your child is getting critically ill, you need an entire health system to manage that child. And certainly it won't be your nearby little shop selling medicine. You'll need extra support.
That is very true. Now, we still continue with it. Then the adults, how do we deal with it? Because I mean, lots are struggling now in the offices, in the homes. The kids, for them, will get well, go back to school, and the adults are really like doing badly, you know, with their cough and flu.
Sophie, the truth is, some of the vaccines that we got when we were little, they need to be restarted. And now, instead of just giving tetanus toxoid to children above the age of 10, they've combined tetanus with diphtheria. Yes, it's now tetanus and diphtheria vaccine. And for me, that's something which is good, because diphtheria affects so many people. And people will get a cough for 3 months. Antibiotic after antibiotic. If they don't get a throat swab and they get correct treatment, they'll keep struggling with that cough and flu until their body system like wipes it out. The other thing I want to mention before I forget is that if you're an adult and you have a cough and flu and a runny nose, you even have a fever, please wear a mask or ask for 2 days off until you recover and then go back to the office, because we can potentially infect the entire office, and it becomes a vicious cycle of everyone has a cough and flu and everyone is sick.
That is a good word that you have mentioned. Now, the common cold, is it something that is around us here?
Right now, yes, it is. We are seeing many people getting this cough and flu and sore throat, and especially because of the rain. So how can we support each other not to get sick. I think
In this season.
the basics.
Mm-hmm.
First of all, if you have a friend who has a friend who is coughing and has a flu, let them get treatment. The other thing is, if you have a cough and flu, you can wear a mask, prevent other people from getting your cough and flu.
Mm-hmm.
And let's wash our hands. Let's wash our hands. During the coronavirus pandemic, the peak of it, we had less cough and flu. Can you imagine?
Very true.
Because people were washing their hands.
And less
And
infections.
now we have forgotten. People were walking around with hand sanitizer. I used to have a hand sanitizer on my bag. But now we've thrown the ball. We are no longer using the hand sanitizer judiciously. So let us relearn how to do the primary prevention. Use our hand sanitizer, wash our hands. Let us be serious about preventing, because yes, coronavirus came and it was a pandemic, but there are still other viruses. There are corona-like viruses still, which are going to cause problems. And you eat healthy, of course, eat a balanced diet, drink lots of water, drink lots of juice, eat your fruits. Uganda is rich. We have a lot of fruits, eat the fruits, and then the green leafy vegetables, which are very helpful.
Then we have some adults who will say, me, I'll take Micah Kavera there, Micah Tot, and then I will be fine.
So those Kaveras and Katots can be immunosuppressive. And if you overdose on them, you're going to also sleep a lot and then inhale the viruses that sit in your nose, and then you can get a pneumonia.
Oh, wow.
It's not sanitizing your throat. It's actually hitting your liver, and it can actually injure you.
Now, we said we're not going to talk about the treatment options, because they'll start writing them down, saying Dr. Sabrina said this. What, besides the honey, this and the other that you've told us, the garlic and the fruits, what other remedies can people use?
Home remedies.
Yes, what home remedies? At least that's the safest for now.
The home remedies that people can use include even steaming with, rosemary. It gives you a good breather, but don't be covering yourselves in buckets for 2 hours. And please watch the children when you steam them, because you don't want to be getting scalds and burns because you're steaming. The doctor said steam.
Or suffocating the children.
You can suffocate the child or even get them scalded. But also getting rest. The sleep, if they give you a bed rest because you have a cough and flu, go and rest. It's not your time to go and kovache you because the doctor gave you a sick off. Actually go into your bed, cover yourself and sleep for an extra 2 hours, because resting is actually improving your immune system. And then obviously drink some warm water to keep you warm, but also complete your medications if they are written. This business of taking your medicine for one day, you feel better, you release, you don't take it anymore. Remember, some of the medicines that we are giving are bacteriostatic. They are not killing the virus. They are just reducing its load and not clearing it all of it. So for me, I'd say that if you're given a prescription by a doctor and they say 5 days, please finish the 5 days. And also, even if you feel better, make sure you complete the treatment. Because some diseases, some bacteria have like a half-life of 3 days, others 6 days, and then if you don't clear all of it, it's going to become a reinfection. So you must finish all the medicine. If you finish the medicine and you still feel bad, go back to the doctor who gave you the medicine. Don't go around shopping for doctor after doctor after doctor. You will get confused, and also the doctors seeing you may be of different calibers.
Very true. Then others will opt to taking, do you call them some soothers that are like sweets for the throat, the mints?
The mint gives you this impression that it's soothing your throat. It has menthol in it, and the menthol helps to open up the nose especially. Some of the mint and the soothers contain a little bit of antihistamine, and it helps to dry up the mucus.
Okay.
So it's helpful.
Okay. So Dr. Sabrina, what is your final take-home message for a person watching you right now?
First of all, I want to say thank you. It's been an amazing interaction.
Thank you.
And also that if you're suffering from a cough and flu, sorry about that. It's not the end of the world. Get treatment. But the last thing I want to say is that let us say no to self-medication. Let us prevent the next pandemic of antimicrobial resistance.
Okay, thank you so much, Dr. Sabrina.
Thank
It's also been very wonderful hosting you. Well, that is all we had for tonight. The next time you'll see her here, we'll let you know what she'll be telling us about, because she did really promise that she'll come back next time. And of course, that is all we had for tonight. Thank you so much, National Medical Stores, for making the show possible. And I'd like to thank the entire team that has supported on this. It is just like about 7 minutes to the top of the hour. Keep watching UBC for the 10 o'clock bulletin with Laureen Kazimoto. Good night.